Time for a second cup of coffee with WICC's Tony and Mike in the morning as another interesting guest joins the show. Here's Tony's conversation piece on WICC 600.
All right, we're sitting here. We're going to chat with Dr. Ellen Mahony, and she is an MD, and we're going to talk a little bit about body shaping. Doc, how are you today?
I'm great, Tony. How are you?
I'm doing good. It's so glad to have you here. Body shaping. Now, many women notice a change in their appearance in their bodies after the age of 35. Is that correct?
It's true. I mean, just about every woman has experienced some starting changes of aging by 35, and one of the main areas that they talk about is changes in the volume and shape of their breasts, common to every woman.
Okay, and what sort of options are available?
Well, you know, up until now, there have really only been a few options. There have been one non-surgical option, and that would be to maybe place an insert inside a bra. And then there have been a variety of surgical options for breast enhancements, such as placing implants, raising the breast, lifting them, or reducing the shape of the breast. But, you know, for women who are looking for something that's not as aggressive as surgery and something a little bit more interesting than just putting an insert in a bra, we now have some other options. And the non-surgical option that I've been really favoring is something called the vampire breast lift, which involves placing platelet-rich plasma, we've talked about this before on your show, into the breast tissue to enhance the shape and volume of the breast and improve the quality of the skin. It's been great.
Now, how was that performed?
It's performed in the office. It's a very simple procedure. We draw about maybe 4 teaspoons of blood from a lady. We separate the blood components to identify the platelet portion, which is rich in growth factors. And then we simply inject that in the breast tissue in an area where the patient has an interest in increasing some volume and shape. So it's provided a wonderful alternative for women who simply want to improve volume and shape without surgery, and also for women who've had surgery who are looking to improve some contour defects, such as filling in an area where an implant may show some rippling after surgery, or filling in an area where there may be some asymmetry after some of the surgical procedures.
Now, after you've had this surgery or procedure, whichever you want to call it, are you able to go right back to work, able to go about your life?
Well, that's the beauty of it, Tony. This is an in-office procedure. It's simple. It's not painless. It doesn't take any time out of a lady's day. Able to return to work with no side effects, no complications, no risks. I mean, think about it. This is your own biologic product from your own body. It's DNA blueprinted. It's specific to your own needs and growth factors. So it's going to be a home run for women. Absolutely.
Sure. I mean, it's come a long way. I mean,
totally.
This could be, I mean, in the old days, it's an exhausting thing.
Recovery. Absolutely. It's days off from work,
Sure.
lost time from just activities of daily living. And now we could offer something that's really perfect and painless.
Okay.
So, you know, to be able to have a painless procedure that does such a wonderful thing is a great step forward.
Yeah, and I'm sure they're chomping at the bit. They'd rather do this than have the surgery.
We've had a lot of calls for this procedure, and the results have been fantastic. And I'm very happy to be able to offer something like this at my office that is painless. It's a short procedure, and it has fantastic results.
All right, we're taking a moment. We're talking with Dr. Ellen Mahony, and we're talking a little bit about, what do you call that, the vampire?
It's the vampire breast lift.
The vampire breast lift. Okay, all right. And, of course, for those who still want to do surgery, you still do the regular implants and all of that?
Yes. I have actually the option to do all of those procedures. I can do the breast enhancement with either implants, a breast lift, or a breast reduction. That's no problem at all. But being able to have something that's non-surgical, and this was developed, of course, by Charles Runnels, who's a fantastic doctor from the Alabama area. And all of the platelet-rich plasma procedures have been highly successful. And this is just another tip of that iceberg that we're seeing in terms of bringing that technology of regenerative medicine into our offices now.
That was another question I was going to ask you. Once you've had this particular surgery, have you ever heard of any side effects or anything like that after it's done?
Not at all. No, this procedure is something you probably would just do once a year, if that, maybe once every 2 years. We've seen good results long-term with good improvement in volume and shape, and no complications related to it. And again, it's natural. This is a natural procedure for women without pain and without complications or risks.
Okay, and you know, it's important. You look good, you feel good, you're more confident. It's important. It really is.
Doesn't get any better than that.
Yeah, you're absolutely right. Dr. Mahony, we're running out of time, I'm sorry to say, but if people want more information, if they want to get in touch with you, is there a website?
Absolutely. I'd love to take care of women who are interested in this, and you can reach me at www.dr.ellenmahony.com. And our phone number is 203-221-0102 in Westport.
And Dr. Mahony, where are you located? Where's your office?
Westport, Connecticut.
You're in Westport. Okay,
Yes.
very good. Anything else you want to hit?
No, just look forward to seeing you again.
All right, sounds good.
Thank you.
All right, there you go. Dr. Ellen Mahony here on WACC 600.